Fire safety and building compliance really for the healthcare sector, I think arguably is one of the more challenging sectors, certainly with your complex buildings and strict stay put and horizontal evac policies. And certainly you've got more stricter inspections and really for most trusts, not even enough money in the pot. So hats off to you guys, basically, for being in the sector in the first place. Starting then with the foundation of it all, which is the fire risk assessment. So in healthcare environments, especially the part one, which focuses on identifying and evaluating those general fire risks across your hospital premises and is trying to keep them all in compliance with the UK legislation. So under this regulatory reform of Fire Safety Order of 2005, so all healthcare premises, whether they're NHS trusts or private facilities, must undertake and maintain a suitable and sufficient fire risk assessment. So the responsible person, most likely to be yourselves in most cases, and under the order, it's typically the trust estate's director or the person in overall control of the premises. So this duty does extend beyond conducting a one-time assessment, and it does require maintaining an ongoing living document that evolves alongside operational structural changes in the building. So under HTMO 502, the hospital buildings must be divided into fire and subcompartments, each typically never exceeding more than 750 square meters, with fire-resisting barriers related to at least 60 minutes, or basically 30 minutes if you're in subcompartments. If a fire breaches a compartment, a wall or a ceiling or a surface penetration, the ability to carry out safe horizontal evacuation is definitely going to be compromised. And so for this reason, compartmentation integrity is considered life safety critical and forms a core part of both the fire risk assessment part 2 and the hospital's overall fire safety management plan. So what are your inspection requirements? So fire doors inspections within healthcare are governed primarily by your BS 9999, which is the Fire Safety and Design Management Use of Buildings. And in there, you will see that doors should be inspected daily, weekly, monthly, quarterly, 6 monthly, annually. There are different things to do at each of those different audits. And of course, you're auditing them in line with BS 8214, which indicated how the door should perform when it was installed. So there are some very strict expectations, and it's just whether that you have the systems in place to be able to do such a frequency of investigations. So one of the end goals that we're all trying to reach here is a comprehensive fire strategy. So the fire strategy is that central document that translates the outcomes of the fire risk assessments into an operational plan detailing how then fire safety is achieved and maintaining that and managing that across the healthcare estate. So in the complex environments such as the hospital, the fire strategies are certainly not optional. They are a legal requirement under the Regulatory Reform Order of 2005 and the Building Regulations of 2010, approved document B. Sometimes as the accountable person or the in-house fire safety engineer, you don't see the wood for the trees. And this is why Firntec created the gap analysis approach. And what we do here is a series of audits evaluating what you have versus what you should have. That solving the problems and certainly working within a live hospital environment presents a unique set of challenges, and that they require meticulous planning, sensitivity, and coordination. So, unlike most other sectors, healthcare, you're operating 24 hours a day, providing that critical care to vulnerable individuals. This means that any fire safety works, whether it's compartmentation, upgrades, door replacements, active system installations, must be delivered without compromising patient safety, infection control, or continuity of care.